Hello, Kathleen. Fine. Today it's fine. And thank you for the invitation and good evening, everybody. Okay, that's my background. I I would share for each of us my really short bullet point about my knowledge, my skills. I'm a biologist, but with a specialization on mitochondrial health and more specifically oxidative stress. I'm working in several scientific society in Italy and Europe. And obviously, but last but not least in that case, I'm a Lifelong Advisory Board member. That's the reason why, or one of the most important reason, based on the fact that today and every Monday, quite every Monday, because of, as you know, one Monday in the month is dedicated to another colleagues, but we are together and to deepening some important and crucial aspect of our health, of our capability of realize and structure a real, concrete, huge preventive lifestyle. That's probably the first reason, the first objective that these webinars, that as you know, it's a calendar, it's not one, it's as I told you before, it's a several event in which we could send you and share with you, show you information for you, the same typical take-home messages, scientific point of view, and then obviously we could put together, based on a specific situation, condition, obviously together, the solution. There is a problem, and in every situation we have a solution. In that case, the solution is Life Farm products. But we immediately go through the topics. The topics of today, it's really crucial because of there is a worldwide hidden epidemiology combined with a pre-diabetes form. That's a real crucial condition because of there is a typical borderline situation in which the people is not already in diabetes illness and disease, but in the same time we could observe, for example, throughout blood sample and blood exams, we could find some indicators that change. And so there is a crucial because of if we have the capability to put under our observation and in our awareness the possibility, first of all, with the food, with the lifestyle, and so exercise, activity, food, yes, I already told you, and eventually, but why not, if it's a natural the approach, in that case, nutraceutical products, like, for example, Life Farm products, we could absolutely block and manage this risk to develop and evolve this situation in a defined disease as diabetes. And so the title is already clear. Are you 1 in 10 adults at risk with pre-diabetes? That's the question because of, as I told you before, there is a global crisis about the fact that more than 460 million adults in the world had pre-diabetes. That source is evaluated in 2021. As you could think with me, the situation surely is increased in terms of percentage and numbers. In fact, by 2045, this number could rise and increase to over 630 million adults worldwide with pre-diabetes. That means, that's the reason of our title, that means that 1 in 10 adults globally may soon live with pre-diabetes. But for all of our best friends and guys, what's pre-diabetes? That's an important question, but also the answer is really, really crucial. The pre-diabetes is not a disease, is not a pathology, and it's not an illness, but it's a condition, biological condition in which the blood sugar levels are higher than normal, and so it's not normal in that case, these indicators, but not high enough to be diagnosed as diabetes. And so one of the most important indicators that we could measure as a sort of cockpit, our cockpit, is the blood sugar levels. Eventually also glycate hemoglobin, but that's more specialized. There is an indicator that the professional, the clinician use when the situation is quite increased. And so the suggestion is maintain constantly measure this kind of indicator, blood indicators, because of could be warning stage this kind of condition. And so we have to maintain focus on this indicator. How, and that's the problem, the real problem is why and how pre-diabetes progresses. The diabetes could progresses and change this status of condition in disease as with the insulin resistance increase. In that case, the typical situation that we found in the body is the struggles of the body to manage sugar, to metabolize, to transform, to use sugar as the most important source of our capability to create energy. There is yes, that's a really, really interesting definition. The ripple effect on your health, it's really a ripple effect. If you follow the situation of our blood sugar measure, we could observe a sort of instability of this kind of parameter. The blood sugar instability, in that case found thanks to the blood samples exams, affects first of all energy, our energy, in that case energy, body energy, focus, and so second problem absolutely combined with the capability of our brain to focus, to accept, for example, some capability to cognitive deepening some information, some document, and mood. Absolutely, the mood, one of the most important consequences of this kind of instability. And that's a sort of a daily condition, daily sensations. But what the real risk that we could go through if have not the capability to control and put on the control the blood sugar levels. First of all, the most important risk is heart disease, but strictly connect stroke, nerve health issue, and obviously weight gain. And last but not least, in a regeneration company has life, for us it's really, really crucial, faster aging in that case. And so, as you know, there is a wide consequence that could last ending if we have not the responsibility, awareness, will to take under control this indicator. Who's likely to get it? And so, but there is obviously a natural condition, natural, sometimes in some situation natural, in other not so natural. But what's the best condition that we could find in pre-diabetes people with pre-diabetes? First of all, the genetics lever, family history. That's typical, as you know. The capability or the risk, sorry, not capability, the risk to develop a diabetes or pre-diabetes is absolutely connected with our family history. But differently, not a genetical approach, but epigenetical, and so concern the environment, the background in which we live, and our obviously everyday habits. First of all, overweight first, or secondly, obesity. That's another pillars of the condition in which we could really risk to go through faster in prediabetes or after diabetes. One indicator when another condition is more than 40 age. Obviously, a lifestyle based on a sedentary situation, and so without exercise, without movement, without walking, obviously important, very, very important, the diet, the food, and so poor and unhealthy food, like for example, refined carbs, sugary drinks, could be absolutely another elements on which we could build this pre-diabetes situation. Ethnicity, and also the sleep quality and quantity. But first of all, I would underline and point out quality. Today, in fact, it's important to maintain a specific REM phase in our sleep condition. And that's the reason why the quality of sleep could impact on this situation. But the nature of our body, the complexity, but also the perfect action of our body regularly send us signals. Sometimes these signs or signals are small, and so not a big information that we received. In fact, the early warning signs of prediabetes, often missed, are as follow. And so please, obviously, every year, once in a year, if for normal people, it's enough. For example, give and regularly have your blood levels, sugar every year, so once in a year is enough for normal people. But don't miss this message from your body. First of all, fatigue, specifically fatigue after meals. Second important sign or signal, excessive thirst or urination. Third, blurry vision, slow wound healing, tingling in hands or feet, and also craving or brain fog, cognitive aspect, difficult also to manage stress situation, and so a sort of physical and psychophysical brain stress situation. That's another potential indicator of our pre-diabetes condition. But the good news, that's real important, based on the fact, as I told you before, that there is in front a condition, absolutely crucial condition, but not disease, not illness, not pathology. The good news that this condition, specifically based on his condition and his characteristics, is reversible. Lifestyle change can normalize blood sugar. And so if you normalize our quality of life in terms of lifestyle, could be absolutely change our destiny in terms of diabetes. And so the prevention and the prediction in that case, thanks to the indicators that we observed and observed in the previous slide, is easier than treatment. Really point out this aspect. The prevention in this situation is crucial. And so our responsibility in that sense is in our hand. The prevention, thanks to the lifestyle changes, is easier and is easier than treatment. That's important. What's the most important lifestyle changes that I suggest you as a nutritionist, first of all? Um, Lifestyle steps that work are, first of all, balance meals. And so, for example, use the typical plate method in which the plate is divided in three main parts, in which in one we put, for example, carbohydrates, in the second one protein, and in the third one fat, but good fat, and so not saturated, but polyunsaturated, first of all. That's a typical method that we use to create awareness on quantity, yes, first of all, of each of food, but also quality. There is really very important that in each of your plate has the best important macronutrients, carbohydrates, in a percentage of 40%, for example. 40% is enough. 30% protein and the rest of fat, but good fat. Other suggestion is low glycemic foods. If you could, for example, evaluate, but today absolutely is in our hand, for example, read the indication of each foods. As you know, there is the sign and the specific information of quantity and percentage of sugar, and eventually also insulinic index. That's not so easy to find, but it's enough also the indication of sugar in the label. And thanks to this indicator, we could find, for example, to avoid food with a high level of sugar and prefer the low level of sugar. Another crucial suggestion is every week realize do minimum 150 minutes of activity. It's important to underline, to point out that the strength training improves the insulin sensitivity and resistance. As I told you before, maintain a quality and eventually quantity sleep condition ideal, because of this condition could help us to manage in a perfect way the stress, and so the stress management in another pillar of prevention. And last but not least, obviously, the weight management. In that case, could be really, in that case, this last suggestion, the powerful lever of all the group that I show now. And so that's real important to follow. That's another suggestion. In Europe, fortunately, we have not so attraction for some of these kind of beverage as this slide show you, but please maintain this focus, and so prefer change and completely modify your habits, avoid, if it's possible, completely food and, in that case, food and beverage um, sugar. Because, as I told you, hidden sugar in drinks and snacks could really increase blood sugar levels. Another situation in which we have to pay attention in glycemic index basics, as I told you. Sometimes it's easy. Sometimes in some food there is a, I repeat, the level in which we have the glycemic index. And so this glycemic index has to low, because of, in that case, we could the guarantee to, for our metabolism to transform and in a sort of way booster the sugar. I suggest to insert in our diet, in our food habits, fiber, protein, and I told you, and healthy fat, good fats, healthy fats. First of all, omega 3, omega 6, omega 9, and so in that case, not saturated, polysaturated fatty acid. In that case, we could stabilize our blood sugar. That's the reason why the PLET, in this case, the PLET method is absolutely positive and effective. That's a three indication from a nutritional point of view. That nutritional support matters. Block. It's important to block or reduce absorption of excessive sugar and fat. And so, based on nutritional aspect, that suggestion is important. And so we understood in the next slides how important food, beverage, and blah blah. But it's important in the same way to reduce to modulate the absorption of sugars. Burn, encourage fat oxidation and calorie use, for example, thanks to exercise, training, and last but not least, boost. Support your digestion, satiety, and metabolic balance. That's another gastrointestinal support that, combined with the other systems, could really help us to support our capability to manage this pre-diabetes condition, or better, in that case, prevent this condition. And now, absolutely, we have another solution. That's not another, yes, another, but strictly combined with the previous one. And so it's really important to maintain all the habits that I suggest you before: food, beverage, glycemic index low, and obviously the attention of some signals combined with, for example, the water and so on. But to, in a sort of way, faster the capability to reduce the absorption, or booster the combustion and the transformation of sugar, we have, thanks to Life Farm pipeline and study, to propose you another possibility to combine with these lifestyle habits also a nutraceutical approach, thanks to Extreme Shape. What is Extreme Shape? Extreme Shape is a perfect combination of several natural source ingredients that are in a logical, that's a typical of life farm, synergistic approach, able to prevent pre-diabetes and diabetes condition. First of all, we have in the formulation white kidney bean extract. This ingredient is up to 66% lower post-meal glucose spikes. The spikes is the peak, in that case, or the spikes is quite the same in terms of translation, is the one of the most risk in terms of post-meal glucose condition. We could avoid high spikes post-meal, obviously glucose post-meal spikes. And so, thanks to the white kidney bean extract, we could, in that case, reduce up to 66% these spikes. That's real, crucial, and important. Gymnema sylvestre is another ingredient able to reduce sugar absorption by up to 50%, and another key elements, carbs cravings. That's important because of, as you already told you, it's important reduce the absorption of this kind of microingredients, and so in that case, macroingredients, yes. And in that way, thanks to Gymnema sylvestre, we could obtain and achieve this result. Ketosane, in that case, mean weight reduction of 1.7 kilo over 12 weeks in trials. That's my in that case, my first support also during my typical weight loss diet. I use regularly ketosane because of this specific activity in terms of weight reduction. And last but not least, calcium. Calcium increases fat excretion by 5 to 8%. And so, as you know, this formulation is dedicated to the weight loss, yes, sure, but first of all, thanks to white kidney and Gymnema sylvestre, to reduce the absorption of sugar and avoid also these spikes. That's a real bad condition and situation. How to use Extreme Shape? The best suggestion is taken with meals. I suggest to use, for example, one, in that case, one tablet, one after the main, in that case, meals. And so in a day, two tablets, but after or during the main meals, could be, for example, lunch and dinner. I reinforce the suggestion to maintain a healthy diet and activity, physical exercise. And now, in this situation, both if we think about extreme shape or healthy diet and activity, it's real important the consistency. The consistency is the key aspect of all our protocol. Okay, that's only I finish my presentation.
I have a question for you because they are I actually today had this question from somebody that there is this because I know that you are also a nutritionist and you also teach people how to eat and what to eat and so on. So, what is the protocol for somebody who has diabetes? Because, there was these two theories that doctors say you just don't eat sugar and carbs. But on the other hand, there is also the theory that you shouldn't eat meat.
Okay, see, okay, I understand. Yes, obviously, only to point out, I want to underline the fact that today we have speak about pre-diabetes. That's not a disease and it's not a pathology. But and so fortunately, we could manage this situation thanks to all elements that we have in our hands: food, exercise, extreme shape, and so. But if you speak about the diabetes condition, obviously in that case, the situation change. That's absolutely a disease with all the characteristic of disease. First of all, the use of, for example, drug. Drug could be, for example, insulin in some situation, or in other situation quite similar, we could use other kind of new drugs that enter in the market really, really recently. Thanks also that this new generation of drugs able to sustain the reduction of sugar, but also the capability to faster achieve weight loss. But and so come back to the fact that the diabetes is a different condition, that's a disease, and in that case, the suggestion from my point of view and the guideline, the worldwide guideline, are already focus on the fact that we has to reduce, first of all, sugar within our food. And so, obviously, as I told you, it's a really important to put under it's quite the same, the suggestion in terms of lifestyle, and so movement, exercise, reduce hidden sugars in drinks and snacks, put our attention on glycemic index of each of our food, favorite and insert in our daily diet, for example, fiber, protein, increase healthy fats, omega-3, omega-6, omega-9, for example. But combined with the meat, today there is a sort of not common agreement in the scientific society. Yes, I confirm you that some studies, it seems to confirm that also meat could, in a sort of way, manage this condition. But till now, I prefer to maintain my focus on the original and actually confirmed, scientifically based confirmation about the fact that, first of all, we have to maintain within a specific quantity, and this is a sort of number that each diabetologist and so specialist that follow this kind of patient identify with the patient. That's real tailored on the specific condition of each of these people. But when we could put in a sort of total amount, daily total amount of food, we could manage some foods that has a different quantity of these micronutrients as a sugar. And so there is, yes, the possibility to use, but with specific and attention on total amount, daily total amount. That suggestion is connected with my previous notes about the fact to maintain lower the post-meal glucose spikes because of in another in a new situation, in another situation, that also in the diabetes situation, that's absolutely to avoid. And so today I prefer to maintain my real my evidence-based medicine approach with the most focus on for example sugar, and so sweet, but also I add carbohydrates. Carbohydrates is a different sugar, it's a complex sugar, not easy sugar like sweet, but it's another potential source of sugar. And so also pay attention of carbohydrates. As I told you, differently, fiber and protein. And when I speak of protein, I speak first of all meat. Eventually, not red meat, would be a white meat, and so chicken, and so. But also now I'm thinking about with you legumes, for example, lentils, beans. That's, for example, another important source of protein that could help us to maintain in balance our sugar levels. And so that's my answer today. I don't know tomorrow, as you know, the science continues change, but till now I prefer to stay on this certainty and give you this information to share with our guys.
And this is, what would you suggest rather to somebody who is in a pre-diabetes state? And because, there is, I hear many people say that, the doctor says, maybe it is time to try a drug for it, a medicine for it. And then, people say, I want to give it a try. Let me see if I can take some, for example, extreme, or fix my diet. So what would you suggest to somebody?
It depends to the glycemic and the sugar levels in the blood, obviously, because of that's the first indicator that we have in our hands, and it is a sort of really a cockpit, that a sort of red light or green white or yellow light. And so it depends for each of us what's the situation of pre-diabetes, but independently to this kind of specific, important, basic indication, I suggest surely to modify our lifestyle habits in terms of food, because of the food is our medicine. The first medicine is our food. In a pre-diabetes situation, I suggest to try to maintain this condition without the use of drugs in terms of pharmacological drugs. Uh, Absolutely. I suggest to use, for example, product like Extreme Shape. That's not a drug. It's a food supplement, nutraceutical supplement, absolutely power, but without side effect of drugs. But slinky combined with change in our real food lifestyle habits, because of, as you know, the food in that case, in specifically in this kind of pre-diabetes or diabetes situation, but pre-diabetes is crucial. The choice, the decision to avoid, for example, all sweet, sometimes carbohydrates, put our attention the label of each of food that we use, because of sugar. It's absolutely to avoid, not only for the pre-diabetes risk people, but for all people it's important to reduce sugar, because of, as you know, sugar is also a sort of source of inflammation. And so independently to the fact that our blood sugar level change, it's important to prevent and reduce inflammation in our body, thanks to the reduction of sugar food based. And so that's important. That's crucial also for us without these magari specific problems of prediabetes. And so, food, absolutely yes. Physical exercise crucial, because in that case we could increase the capability to transform, to in a sort of way burn fat oxidation. But as you know, fat oxidation is a consequence of the fact that sugar is the first source of our body to put in a sort of reserve. And so the transformation from sugar to fat is quite sometimes it's quite faster. And so if I increase the fat oxidation, absolutely I could give a crucial helps to the sugar metabolism, and in that case the calorie use. And so the exercise, the daily exercise, it's not important to do a marathon, really real, as I already told you before. It's enough to sustainability and the consistency. The consistency is better than one event, for example, in that case, training events. The consistency every day, as I told you before, or every, I repeat, if you want, 150 minutes week of activity could be enough, obviously spread during all 7 days, to guarantee a sufficient prevention to develop from normal situation to pre-diabetes, and then in that case the passage to diabetes. That's my suggestion. I said, and so I summarize. If you could not start with the use of the drugs, pharmacological drug, I suggest to modify our habits, eventually, or absolutely suggest also in some situation use nutraceutical, in that case a food supplement like Extreme Shape, that's natural, recombined with the food, beverage, and physical exercise.
I heard something today because, as I said, with some friends, we had this conversation about pre-diabetes and diabetes, and somebody told me, and from the group, somebody told me that he doesn't has a problem with pre-diabetes, but he likes to eat a lot in the evenings. So his doctor suggested to take this medicine that they give to the pre-diabetes so he can eat more.
Yes, yes, that's strange because of typically the use of drugs is to not to new increase the quantity of food, or okay, in that way with the drug we could continue to take a sweet and blah blah. In my mind, but in the mind of a professional or nutrition is okay. I prefer to suggest your healthy continuous conditions and situation maintaining, and so in that sense I prefer to avoid drugs if we could. Sometimes it's impossible to avoid the drugs, and so I absolutely I'm my first my develop my first training and my skills are in the biotechnology district and the biotechnology field, the pharmacological field. And as you know, this is all drug, all biotech drug. And so for me, it's absolutely important to suggest this kind of protocol. But if we could manage the situation without this drug, because the drug, as you know, could not only benefit, but also side effect. And it's not so small, the side effect from drugs. Sometimes are real important. And so we have regularly to put on our hand a sort of balance with the advantage and advantage. That's
Yeah.
the real condition on which we had to decide what to do also in terms of use of drugs. And so for me, it's important to stabilize this situation thanks to a new lifestyle, not avoid sugar because of this. That's important. It's not a drastic approach in which we could cancel sweet, cancel carbohydrates. No, it's important to maintain a balance and right balance. And if I increase the crabs of this source, I could insert other source like, for example, sugar. And so there is a sort of balance in every situation in the life is the same, also in the nutrition. And so I prefer to suggest eventually to use a food supplement like Extreme Shape. Yes, this is, but if it's possible to avoid drugs. Till is it possible? Then the situation changed because there is a genetic acceleration and booster and blah blah. Okay, in that case I could start, but not to increase newly the quantity of for me sweet because of there is newly a problem because of probably I has to start with the dosage of drug, then I has to increase the dosage. The dosage of drug could represent a risk to increase the side effect, and as you know, the cycle is it's without conclusion. It's a long story in that sense. Ciao, Kathleen. Thank you. Bye bye. I hang you. Ciao.